get good advice. Do not give up. Listen here to AJ's part, but she takes science and a little art, so you can recover hard, recover smart, recover hard, recover smart. Trust your mind, trust your heart, recover hard, recover smart, recover smart.
Kayaka runner and former netballer AJ Davis ruptured her ACL during a netball game on November the 19th, 2024. In Recover Hard, Recover Smart, AJ interviews athletes, coaches and other experts to learn real-world insight to help guide all sports people through the dark and challenging journey of recovering from injury.
Recover smart. Recover smart.
Hi, AJ Davis here. Thanks for tuning in to this chat with Dr. Travis Brown. Travis is a pathologist for ClinPath Pathology, and a few things that surprised me in our talk that I want to draw your attention to are how blood clots happen after ACL surgery, the common symptoms and how to treat them before it can become life-threatening, as well as how likely infections are after surgery and how to prevent them. I hope you find this helpful. Hello and welcome back. Today I'm joined by Dr. Travis Brown, who is a general pathologist at ClinPath Pathology. He is also the co-host of the This Medical Life podcast. To start off with, Travis, you specialise in the pathology field. What is pathology?
So pathology is essentially, the best way to describe it is it's the study of disease. And so there are different fields in pathology. And so some looks at blood, some look at tissue. So, you know, someone has a biopsy. Some looks at the chemistry. So the blood, when you take a blood test, we look at the chemistry. Some's microbiology. So, you know, you have something that you want to grow up, a skin swab or something like that, or, you know, cough something up. That's, you know, micro. And so it's different fields, but you're actually looking at what causes disease. And this is what we study. And so we will learn how to treat that. That's often done by other doctors, but we actually look at the diagnosis, and then the advice to doctors is about what to do with that.
Oh yeah, interesting. And so you obviously don't specialise in ACL injuries, but when you were at med school, did they cover anything like about knees in general?
Yeah, so you do get the curriculum of medicine's changing, and the reason why it's changing, even when I was going through it quite a while ago, about 20 years or so around, is that there is so much information. It is actually hard to cover everything. And so you would get a general understanding. So things like anatomy were taught, and you would come across large injuries. You know, again, ACL would have been mentioned, but it also would have been mentioned with other knee injuries.
Yeah.
The reason why ACL would have been mentioned is just because of the most common ligament damage. And not only that, a lot of people have ACL injuries, and so people's personal experience comes into it and say, oh, I had this, and recovery. And so, yeah, you do often come across the main injuries, but yeah, it's sort of not delved into too much unless people want to go and do orthopedic surgery and stuff. So there was a little bit of personal preference as to how much you learnt about that kind of stuff.
Okay, yeah. And did you learn much about sports injuries in general?
Well, when I was looking at specialising, so when you become a doctor, you sort of just become a junior doctor initially, and then you learn to specialise.
Yeah.
One of the things that I loved was sports. I grew up living sport, sort of playing basketball and everything. And so one of the things I considered at the end was, do you want to go into sports medicine and stuff? So I actually learnt a lot about, sports injuries and recoveries just out of my own interest when I was doing it. But then it was looking at pathology or sports. And so I did learn a fair bit about it, but that was sort of more my own interest in that area.
Fair enough. What was the most interesting thing you learned about it?
Well, the strange thing is when you read about it, when you actually talk about how people recover from it. The actual surgery itself, so they actually use tendon to repair the actual ligament, which can be from like the back of your own leg or from your patella, or they can use one from a cadaver. So dead bodies, they can actually get it's called it's a part of what we say. If you use it from the person themselves, it's an autograft, so they move it. If they use it from dead bodies, it's an allograft. But what we know is that injury, that taking it from the dead body person doesn't recover as well as one from itself. And you know, I remember sort of trying to work out why the ligaments and tendon injuries take such a long time to recover, and it's because of blood supply. And so tendons and ligaments don't have as good a blood supply as skin and muscle, which is why it takes sort of months to years for that to recover, as opposed to, you know, a muscle injury, like a really bad muscle injury can take weeks to a few months. And so that was sort of the interest of there. But the different kind of what's you know, when they actually do the dead body one, people do have a little bit of trouble understanding where's that coming from.
Would there be like many complications if you used it from a dead body rather than your own self?
What ends up happening is people repair the ACL, but your body actually repairs it over time. And so that's why you're actually just keeping it stable for that time. And so your body actually replaces it over time anyway. So there's not sort of a rejection or anything like that you worry about with organ transplants or anything. But what the evidence shows that people actually recover better from their own body tendon using to replace it, as opposed to sort of, but it depends on who they are, it depends on their stage of life, depends on how active they are. If they're elderly, it might not be such a problem, but if they're going to go back into heavy competitive sport, you might want to use something. But it'll be actually preference and what the surgeon actually thinks and what they're used to as to what they would use or what they would recommend.
So post-surgery, I had my ACL surgery late last year. They told me to put waterproof bandaids over my scars for a little while so it didn't get infected. But if I didn't do that, how bad would the infection would have been? Well,
see, the thing about putting things over skin is we ordinarily have sort of organisms on our skin anyway. And so waterproof probably wouldn't have helped much. Like it's keeping it clean, and that's fine. You try and keep it dry for a few days, which is what that would have been aiming to do, because effectively we can have what we say, while we got normal organisms on our body, they don't cause us problems. But there are a few skin organisms that do, like Staphylococcus aureus. It's a common, it's a bit of a name, bit of a full name, but it's a common organism that causes skin infections, and you don't want that on recent scars. And so you're trying to clean. Now, people just ordinarily have it on their skin. Some people just carry it around. But it's just trying to keep the skin uninfected, clean. And if you do, then we do treat it with antibiotics. But the main thing about that is you don't want it, because you've created an artificial tract through into the joint. If a joint becomes inflamed, it's called septic arthritis. That's very dangerous. That can be really affect the surgery and affect your recovery. And so that's sort of the entry point, which is why they would have said try and keep it clean for the first few days. But it means that you don't touch it and play with it and increase your likelihood of infection. But you can't sort of, once it's at that stage, it's just keeping it clean, which is the main thing.
Do you reckon getting infections like that are like likely, or like most people get them?
It's a small percentage that do get them, and we'll treat when surgeons are very interested in the scars. They will check their wounds all the time, and that happens in hospital. They'll look at it, looks good. If there's a bit of sloughy stuff coming off, then they'll say, okay, we'll probably get onto that pretty quick. So surgeons are very concerned about scars, because not only that is just an infection in itself doesn't just risk the operation, it sort of also makes the scar a bit worse. So, surgeons everyone's very focused on post-operative management and sort of skin infection and management of the wound.
Yeah. And they also told me to take blood thinners after surgery, so that it would like reduce the risk of blood clots forming in my leg.
Yep. So a common problem about people going into hospital is immobility. And so people not moving around because they're in bed for whatever reason. And so what ends up happening is you have an increased risk of forming blood clots. And the problem with blood clots is, again, it can be life-threatening. So you'll hear about deep vein thrombosis and everything. It's one of those ones that we know we want to protect against, particularly patients who are orthopedic surgeons, orthopedic patients are at risk of getting these blood clots. And so they just generally will go into hospital and be on automatically, put on things like we say Clexane and stuff to reduce the risk of blood clots.
Oh, yeah.
And so this would have been done. You just by being a sort of orthopedic patient, having orthopedic surgery will increase your risk of having the blood clots. So we're just trying to avoid that. That's one of the complications. And yes, you would have been much less mobile.
Yeah.
So, in hospital, less mobile, orthopedic procedure, your risk of getting a blood clot increase, and we just really want to avoid that complication.
What is a blood clot, and how do they happen?
So the main thing is, our blood circulates through our body. It's a remarkable system, but it circulates through our body in a fluid component. So there are some people who have clotting disorders, and they'll get blood clots. The problem with that is when you get a blood clot, the reason blood works so well and gives our brain and organs nutrients is it just keeps on flowing. As soon as you create a blockage, you then starve that area of nutrients. And so if that's a really critical area like a brain, part that will cause brain damage. If it's in your heart, you'll have a heart attack. If it's in your organs or anything, then it will start to actually cause what we call ischemia. So reduce blood flow and oxygen to that area. And if it's long enough, those parts will die. And so that's the problem. If you get a blood clot in your leg and then that blood clot goes up, it can hit some really critical areas. And so that's why we're very focused on that. And so our body is just normally circulating, and we've got a whole mechanism that once you get a cut, it will clot to stop blood from exiting.
Yeah.
The problem is if that goes overboard and starts clotting everywhere, people will potentially die from that.
Yeah.
And so that's the amazing mechanism that we have a whole system that we've learnt over hundreds of years, that there's a whole cascade of things happen for blood to go from flowing to adhering and clotting to stop bleeding from happening. And so that's there's a number of diseases where people are prone to having clots. We need to treat those patients. There's people who are prone to not clotting and they have bleeding issues. And so it's sort of one of those balancing mechanisms of our body to be able to just have fluid that circulates but then can actually stop excessive bleeding when we need to. So, yeah.
Would you be able to tell, if you had a blood clot, would it hurt?
So what the most common symptom for a blood clot, in the leg, is you get swelling, what we say unilateral. It's one-sided leg swelling. And the reason is because you've got blood flowing. If you put a blood clot there, blood will build up and it will increase the pressure in the blood vessels, and then fluid moves out into the other spaces around. And so someone will get this, one-sided leg swelling, and you can actually feel sort of some of the fluid there. And so they'll go, okay, my leg's just swollen for no real, often they might not have pain, they might have a little bit. But you'll sit there and just go, this looks like a DVT, and people will need to do an ultrasound and look at the blood vessels and say, yeah, something's stopping the blood from flowing, and that's a most likely blood clot.
Yeah, right. Okay, and one last question to finish off. What is something you would definitely not do after ACL surgery to make sure you don't get an infection?
It's actually just keeping. First of all, it's keeping active. But to stop an infection, it's actually just probably not playing with the scar early on the first few days, and then it's just keeping an eye on it. And so, what people will tend to know is if you take off a bandaid or something, you'll see this yellow or sort of even pus there. That's actually the start of infection, keeping it clean and stuff. And so that's the main thing. It's just keeping an eye on the wound. You'll actually know if something's sort of weeping and it gets worse and worse. And that's when you start to know, oh, something's growing there that shouldn't be growing. And this is why, we keep an eye on it. And it's actually once you start to see that part of it, it's keep an eye on it. Mm-hmm. Often you'll go to your doctor, they can swab it and actually grow it up and say, we'll treat, or they may even treat without swabbing it because we often know what the organisms are. So.
Nice.
All the best with your recovery with your ACL.
Thank you so much for talking to me. Thank you.
It's a pleasure.
Thanks for listening to Recover Hard, Recover Smart. If you found this useful, AJ would really appreciate it if you let a friend know about it. She knows that recovery is hard, but this podcast is doing its best to shine a light on some smart ways of getting through it. If you'd like to learn more about AJ's story and this podcast and discover other resources and insights to help you on your recovery journey, visit this website, recoverhardrecoversmart.com.au. That's recoverhardrecoversmart.com.au.
Recover hard, recover smart.